The symptoms and triggers of a herpes outbreak. The symptoms of a genital herpes outbreak can vary widely, depending upon whether you are having an initial or recurrent episode. However, many people infected with genital herpes never experience symptoms. Initial episode. For most people, the first herpes outbreak is the most severe, and symptoms tend to be more severe in women than men. The first outbreak usually occurs within a few weeks after infection with the virus. Symptoms tend to resolve within 2 to 3 weeks. Likelihood of reoccurrence. Genital herpes recurs frequently in many patients, especially in those with HSV type 2. Over time, reoccurrences generally become less frequent and less severe. However, it is possible to have a reoccurrence a few years after the initial HSV infection was acquired. This type of delayed herpes outbreak can be especially distressing if you have never had symptoms during the initial infection, leading you to worry about the sexual activities of your past or present sexual partners. Prodrome. As many as 50% of people with recurrent outbreak experience symptoms before ulcers develop. These are called prodromal symptoms and may include itching, tingling, or pain in the buttocks, legs, or hips. Reoccurrences tend to become less frequent and less severe after the first year. Triggers for reoccurrence. Illness, stress, sunlight, sex, fatigue, and surgery can trigger recurrent herpes outbreaks. In women, menstrual periods may trigger an outbreak. You may be wondering when you became infected. The first time a person has noticeable signs or symptoms of herpes may not be the initial episode. For example, it is possible to be infected for the first time, have few or no symptoms, and then have a recurrent outbreak with noticeable symptoms several years later. For this reason, it is often difficult to determine when the initial infection occurred, especially if a person has had more than one sexual partner. Thus, a current sexual partner may not be the source of infection. Hopefully this video has helped you in some way. Please consider supporting us through the links in the description below, or consider subscribing to our channel and liking the video. Thanks for watching. We'll talk again soon.